Hi, I'm Dr. Smith. Here at HollowBrook Dental, I want to walk you through the process that's going to take place when you come in for your consultation with us so that we can decide which options are going to be best for you, which solutions are going to work the best for you. The first thing that we're going to do is we are going to acquire a three-dimensional X-ray. This CT machine, which is located here at HollowBrook Dental, is what is the first step we're going to do in order to get that information. You're seated very comfortably in the chair, and then the CT machine will go around the head and it will be able to acquire all the information that we need. The acquisition of the CT scan is critical in allowing us to figure out what the dimensions of the bony structures are. The structures in your mouth may be perfectly fine to receive dental implants, or there might have to be different supplementation or augmentation procedures in order to receive a dental implant. But this CT machine accurately gives us all the information we would ever want to need in order to determine which would be best for you. And it's that easy. It doesn't take long at all. The next step in the process is to very accurately record the tissues and the teeth and all the anatomy that we need in order to fabricate a very accurate bridge. And what we're going to show you now is, instead of using the goop and the impression material that a lot of offices use, we use digital acquisition for as much of this process as we can. And this is the process of how easy it is to record these structures. So as Dane is recording Jamie's teeth, it very easily comes up on the screen so he can see exactly where he's at. And this whole process of recording all of these teeth on one arch takes very little time compared to the gagging and the goop that we had to use in the past. This has really been a game changer for us, is being able to have this kind of technology in our office. One of the final steps of properly fitting the bridge to perfectly placed implants is the acquisition of where exactly those implants are. Now, in the past, what you're about to see took about 4 or 5 appointments and about 10 to 15 hours of clinical time with goop in the mouth and custom trays and verifications and everything else. There's only less than 20 of these cameras in North America, and HollowBrook has one of them. So what Dane is doing here is actually recording the implant position, not only in the XYZ axis, but also to each other. And it takes that long. He's just about done with it, and that's it. And that is the process that replaced all those other appointments, which took, like I said, 10 to 15 hours of clinical time in my hands. Now that we have all the information that we need in order to determine which solution is going to be best for you, the next step in the process is to take all of this information and appropriately schedule you for the surgery that takes place in order to place some implants or maybe remove some broken teeth or decayed teeth or abscessed teeth. But that would be the next step that we do once we have all of this information in place. So it's your day of surgery. One of the benefits that we have here at HollowBrook Dental is our own in-house surgical suite. That's what this room is here. In this room, our team of oral surgeons will perform the surgery necessary for you to receive the implants in a very comfortable way. It is fully equipped with everything they would need to allow them to do the best work possible. One of the advantages of having an in-house surgical suite is that when our team of surgeons are finished with the implant placement, we come in and then we can create the scans that we need, any impressions that we need, so that within one day you can receive your final bridge.